Hi, I'm Dr. Anthea Rhodes, paediatrician, joining you live from the Royal Children's Hospital in Melbourne for a Facebook Live discussion today about how we can support our teenagers in their transition to life after lockdown. I'm joined by a number of experts from our campus partners here, the Murdoch Children's Research Institute and the University of Melbourne. Before I get started, I'd like to acknowledge the country we're on today, and for me here, the traditional owners of the land, of those of the Wurundjeri people, and from wherever you're joining today, the traditional owners of the land from which you meet. And a special welcome to any Aboriginal or Torres Strait Islander people who are joining our conversation today. It has been a really challenging time for lots of people around the world, and particularly for us here in Victoria and other viewers who might be joining us from New South Wales or other parts of Australia. Recently, it's been a big relief to see that the lockdown has ended and we're emerging now into life after lockdown with stay-at-home restrictions finally lifted, and what that means for our children and teenagers and young people is a return to their normal life, and in particular a return to school. That's exciting, but it's also a bit daunting, and what we know is that many of our teenagers have had significant impacts on their mental health and their well-being throughout the pandemic, and the transition back to life as a new normal may not be that straightforward. So today we're going to talk about a few of the things that might be worrying you or your young person at home. We'll cover topics like the risk of catching COVID-19 itself and what that illness might look like for a young person if they do catch it. We'll talk about stigma and some of the issues that are associated with a diagnosis that people are starting to experience. We'll also talk about some of the other mental health problems that we have seen on the increase during the pandemic, and that's things like anxiety, depression, and eating disorders. We'll talk a little bit about healthy habits and things you can do to help your teen stay well, things like screen time and sleep, many of which have been thrown out of whack a bit with the pandemic. We're aiming to give you lots of tips and information that can help you at home and also help you to know if you might need some extra help and where you can go for that. Today is a live session, so we've got viewers joining us, thank you, on Facebook Today Live, but we know not everyone can be here at this time, so we're recording it and it will be available afterwards on Facebook and also on YouTube and on the Royal Children's Hospital website. A big thank you to everyone who has sent through some comments and questions. We'll do our best to get through those today, and if you've got anything else that comes up as you're watching, then please pop it in the chat and we'll do our best to get to that too. So now I'd like to introduce our panel of experts joining us from their own homes or places of work, as we are still involved in some remote learning here from the Royal Children's Hospital. Firstly, I've got Dr. Linda Cader. Linda is a psychiatrist in the mental health service here at the Royal Children's Hospital. Next on screen there is Dr. Lisa Mundy, who is a psychologist and senior researcher with the Murdoch Children's Research Institute, particularly in the area of adolescent mental health and wellbeing. Next on screen there, Associate Professor Tom Connell. Welcome, Tom. Tom is the Chief of Medicine here at the Royal Children's Hospital and also a specialist in paediatric infectious diseases. Next up is Dr. Michelle Yeo. Michelle is also a paediatrician and a specialist in adolescent health here at the Royal Children's Hospital. And finally, Dr. Chelsea Hyde. Chelsea is an educational and developmental psychologist with the University of Melbourne, where she's also a senior researcher. And Chelsea's also got many years' experience as a school counsellor, which will be really helpful for us in our discussions today. So welcome to everyone. The first thing I'd like to talk about today is actual COVID itself and how it's affecting teens. The reason that it's important to chat about this is because it's a very real and genuine source of worry for a lot of young people, particularly as lockdown has lifted and we're having more exposure out there in the community to COVID. So firstly to Tom, can you talk to us a bit about what the experience has been here at the hospital, particularly when it comes to COVID-19 in the teenage group?
Thank you, Anthea, and it's a real pleasure to be here today as part of the panel, as part of our campus representation, and I welcome everyone online today joining us for this session, which I hope will be a positive session for us and sort of some good news stories and also, as you rightly pointed out, some tips. But yes, I talk to my friends and colleagues outside of work, and people are worried about what happens or what's our experience in children and adolescents and teens who have had COVID-19 infection. And you're probably well aware of the statement that goes around saying that typically in children, it's a very mild illness. And the numbers of COVID cases that we've been getting in daily press conferences over, people are wondering what proportion of those might be in the teenage age range. And it's about 1/3 of cases will be in age less than 18. So that may initially concern people because they think there's more COVID in the younger age group. And the reason that is because as we vaccinate more and more of our adult population, there's more and more of a population that have not yet had the chance to get exposed to the vaccination. But obviously our 12 to 18-year-olds have at this stage done it in record numbers. But to cut to the chase, the most important thing from our experience to tell the viewers out here is that COVID in teenagers is in a very mild illness. The evidence says that actually it's a very mild illness in it, like it is in children. And that's important to recognize. So children and teens who get COVID, only about 1 in 500 of those will ever end up receiving hospital attention. And when they do, most of the people who are hospitalized don't end up staying in hospital. They might be treated at home, in hospital in the home, and just receive monitoring. So the message is pretty clear from all over the statistics that in the teenage age range, it predominantly is a very mild illness. That's not to say it doesn't occur. Severe illness does not occur. It does occur in a very, very small minority of patients. And some of those have identifiable risk factors that put them at risk of a more significant type of illness. And we may want to come back to those at some point. But the message is that COVID-19 is predominantly a mild illness in the age range up to teenagers. And that's important for the viewers to recognize. So in case you've heard other stories about the fact that it's more severe in adolescents, that is not being borne out by the information that we're receiving from all over the world in terms of the severity of this disease.
Fantastic. Thank you, Tom. And I think that will be reassuring for a lot of parents to hear, because there is a lot of concern and sometimes confusing or mixed information out there. One of the questions that has just come through from Sarah, and I'll come back to you specifically about this also now, Tom, is about long COVID. So Sarah has specifically asked, even though COVID infection is mild in teenagers, what about long COVID? And is that still a possibility if my teenager doesn't have symptoms when they catch COVID?
Yes, so I think that's a great question, Sarah. And I think there's been a lot of people worried about long COVID since the initial reports came out from the United States saying that children, for some reason, may be more susceptible to long COVID. The most important thing to recognise is that has yet not been borne out by the evidence. And a recent study done at the hospital here will provide very reassuring results to parents that that long COVID symptoms were very, very small numbers of patients when they've been followed, and the vast majority of symptoms had disappeared by 3 months. The question about asymptomatic in the teenagers is an interesting one, but I think that vaccination will likely directly impact on any potential long COVID in that cohort. So the message is to the viewers out is that long COVID, the studies so far, many of them have had challenges in design. That's important to recognize. So they can't be completely judged to be accurate. But the ones, when we've looked at over 14 studies in over 20,000 children, the rate of long-term COVID was very small. And people who got COVID had symptoms of, some of the symptoms were very general. So people who didn't even get COVID had the same symptoms. And that's just due to the pandemic and some of those. So there's an overlap there. So from my point of view is, the take-home message is long COVID is rare at the moment in children. Vaccination is likely to positively impact on the incidence of long COVID. And in vast majority of circumstances, long COVID symptoms disappear by 3 months.
Fantastic. Thank you, Tom, because it's definitely been a concern out there for parents. And good to hear also that information that vaccination, because that was a related question that we've had come up, does positively impact. So as in reduce the chances of long COVID. So if your teenager is vaccinated, obviously they're less likely to get COVID at all. They're less likely to get very sick from COVID, and they're also less likely to get long COVID. So
it's an indirect benefit. If you're trying to protect yourself from COVID, you shouldn't get long COVID.
Yeah,
and that's important to recognise. So there may be a positive story to be told there as it plays out.
Fantastic. All right. So perhaps related to that, Tom, we might come on to the issue of how teens can make themselves feel safe or protected in the school environment. And so I'm going to come to you, Michelle, with this question. So we know that there's a number of strategies that are in place to keep kids safe from COVID, reduce the spread at school. Can you talk to us a bit about those, and also what might be helpful for teenagers to think about and parents to talk with their teens about when it comes to them protecting themselves? Michelle.
So in terms of, I guess, teens looking after themselves, obviously it is wearing masks, the general rules of, sanitizing and not gathering in large crowds, but also more generally looking after their own health overall. So if you're physically healthy, that also really helps, and being mentally healthy as well. And we can talk a little bit about mental health afterwards. The other thing I think is that schools are doing a great deal in terms of trying to mitigate the risks of COVID circulating around. So things like ventilation helps. And there has been a big push, as Tom was mentioning, in terms of vaccination and getting vaccinated really decreases the risks of catching COVID, but also decreases the risk of passing it on as well.
Fantastic.
And I think the other things to think about also are being, I guess, careful about testing is the other thing. Going to get tested when you have mild symptoms, and letting parents know about, what symptoms you're having.
Fantastic. So reminding teenagers about those things, and I guess giving them an opportunity to have some control and ownership and a bit of responsibility across those things. So we heard you just talking about masks, Michelle. Obviously in schools there's ventilation, vaccination for everyone who's eligible, and early testing. Tom, did you have something to add?
Yes, I was just about to say, I was about to compliment and sort of talk to the parents out there who've really encouraged their teenagers to get a vaccination. It's been unbelievable. We've got super teenagers in Victoria. I mean, the rates of vaccination are extraordinary in that cohort. There's a real appetite for vaccination. So that is a really amazing performance, and all the parents should be really proud of the way they've encouraged their teenagers to get that vaccination and talk them through it. I just want to back up Michelle's comment. These are all mitigation strategies that add to rings of protection, and nothing's perfect, but all of these help. So if you drop your guard here and there, it's not going to matter significantly, but it's all about cumulative. And the schools, we're well ahead of the game with ventilation in Victoria. So there's really good investment in the ventilation systems into schools. And that's really, really important. And I think that the vaccination rate is going to be, we're ahead of the curve compared to schools that have opened up in other countries with lower vaccination rates, where we can tell what's happening. And we might come back to that to give further reassurance for parents later.
Yeah, fantastic. Thanks, Tom. We have had incredible vaccination rates, and I know that some parents out there may still have some concerns about vaccinating their teenager or young person, or perhaps even concerns about vaccination for themselves. And so I would really encourage you to have a look at our website at the Royal Children's Hospital, and some links that we have there to some really great resources also from the University of Melbourne around vaccine facts. And of course, talk to a trusted healthcare provider if you've still got concerns or questions about vaccination. Another really important thing that has come up over the past month or so in teenagers is the issue of needle phobia or needle aversion. And so for some young people, it's actually that needle phobia that is creating one of the reasons or barriers to them going ahead and getting vaccinated. So there's also some resources. We've just done a really great podcast that we're going to be releasing actually later today from the Children's Hospital about how you could help your young person and what other resources are there to help them get vaccinated if they're worried about having needles. And there's lots of great strategies out there to assist with that as well. So I'd like to move on then from conversation around the risk of COVID to a bit more about the fear of COVID. These things are obviously very closely related, and as a community we've all had a lot of fear of COVID for very good reason, in that we, particularly before vaccinations were here, we were very concerned about how people might get very sick, and there are people who've lost loved ones, and we have had deaths from COVID, largely in older adults and fortunately not in children. But this has created a sense of worry that is really hard for some of our young people to let go of. And so I'm going to come to Linda now for some discussion about this, and where we have young people who are actually so frightened of the concept of COVID that it's affecting their ability to actually get back out into the community. And I've got a question that I'll read out from a parent called Vicky that really captures an example of this. So Vicky said, "Can I have some advice about how to help an anxious 13-year-old understand the shift from lockdowns and COVID zero to being back out there at school, out in the world when case numbers are actually higher than they've ever been? She's fully vaccinated, but she's still struggling with the idea that she could catch COVID and maybe she could unwittingly pass it to others. Being back at a busy high school is proving very anxiety-provoking." So what sort of suggestions have you got for Vicky, Linda, and other parents listening who might be having this experience?
Thank you, Vicky, for the question. I think it's a very, very important question for this time. And thank you, Anthea, and the panel. Really great and proud to be here as part of the Royal Children's supportive community for our parents. So the fear that the child is experiencing is really a natural, real fear. And the child, your child, and kids like your kid haven't actually been exposed to such a fear of going to school. It's a dread and it's a terror. So when a child is experiencing that level of undealt with fear at the present moment, they don't know what to do. So avoidance, wanting to withdraw, having behavioral symptoms like anger, anxiety, crying may crop up. So the advice in that situation would be for the parents to be very realistic and practical. The kid may not have the capacity to sieve the information from media or newspapers or even us and figure out what is the right one. So for us to be cautious about what we are listening to in the media and give the correct rational explanation in a way that's meaningful for the child. For example, the cases are going high, but we are actually open from last Friday because the vaccination rates have really gone up. And there is news from the government, there's extremely good news that even 5 years and over would start getting vaccinated. So the situation is, yes, there is a risk, but as Tom has highlighted, that if someone is vaccinated, the risks of severe illness is way less. Adolescents and teenagers are at lesser risk compared to adults. And ventilation, school surroundings, the teachers being aware and knowledgeable about any vulnerability that might be there, immunodeficiency or any other problems that your kid or someone else's kid may get a special attention to it. And I suppose the last and we may actually talk a little bit more on that. It is not a one-shot preparation for your child. As they're returning, it may be a daily support, a daily sort of check-in with your child, a daily sort of check-in before they go to school and come out of school as to how the day has been. And as that goes on a regular basis for a few days or weeks, you would see the difference and the confidence that's coming up on your child's mind frame. Things may change, but I think one of the things that we know from the government that we may not revert back to lockdown because we are moving forward in new normal with COVID. So future is still kind of slightly unclear, but I think with this advice, hopefully we can move forward.
Thanks, Linda. And I think what you've touched on there is a couple of really important things, and I might come to Chelsea next to add some comment around that as well. And that's the concept of uncertainty and the fact that we've really asked a lot of our young people, of all of us, have been asked to deal with a lot of uncertainty. And that can be more challenging for children and teenagers than it might be even for us as adults. And that may be part of this difficulty. So, Chelsea, what sort of advice have you got about dealing with that, how parents might talk to their young people about that?
Thanks, Anthea. Well, look, we know most of the time that our young people are also incredibly resilient. So for a lot of them, they're going to ease back into this transition out of lockdown again quite well. But there is a level of uncertainty still around in terms of, when cases pop up in schools, we're having still snap closures and things like that. So I know that young people are going to be quite anxious in that unexpected, event occurring. So I think it's just really important that we keep the lines of communication open with our young people, hear about what they're worried about and try to, address some of those concerns directly where we can.
Fantastic. And that brings us on to something that's related, and Linda's just touched on it as well. And I know we've had a number of questions from it on this topic from parents. And there's an example here from Megan, who just said, what about school refusal? So I'm finding my 14-year-old boy is worried generally, not too sure exactly what it's about, whether it's COVID or perhaps getting back to school, but he just refuses to go. So school refusal has become a real challenge throughout the pandemic, whether that was refusal to log on remotely, and now we might be seeing that disengagement or refusal to actually get back to being on site at school. So Chelsea, having had lots of experience as a school counsellor as well, even before COVID, school refusal existed, but it's become a much bigger problem through the pandemic. Can you talk to us about some practical strategies there?
Yeah, thanks, Anthea. It's really important where we can to find out what the root cause of the school refusal behaviour is, to try and identify if that is concern around academics or if it's to do with any mental health reason, social concerns, or even just fear of illness and being unwell. So to support a young person appropriately, we first need to identify what it is that they're worried about. Then we can work collaboratively as a school with the young person and the parent and any other professionals who may be involved. And often that might be something like a staggered return, where we ease the young person back into that environment, but also directly address those anxieties or the worries that they're having to make sure that they have got access to the support that they need, whether that's academic, mental health or socially.
Fantastic. And one of the things I think that relates to this, and you could perhaps talk a little bit more about, is friendships and social connections. So one of the things that we had a few comments come in around this theme is worries from parents that they feel like their child has really lost those social connections. They may or may not have engaged online with their peers, and that experience might have been mixed. It can be really a tricky place on social media, and if that's become the only place where teenagers are interacting with their friends and peers, then that might have been a really difficult experience. So for parents thinking about that, how they can help their teenager to reconnect with friends and peers, what advice have you got there, Chelsea?
So firstly, just validating for them that, yes, that is a really real concern, and a lot of young people are expressing that. They've been out of school for some time. So we know with adolescent girls in particular, they're very fearful about the fact that their friends might not be the same when they get back to school, and are people still going to like me, and really worried about that. Also, whilst young people have been at home, they've had a lot more control over their social interactions. It's a little bit easier to control that when you're at home doing your learning versus running into people in the schoolyard or in the classroom if there's some, social issues that you're having. We also know from the lockdowns of last year that there does tend to be a bit of a honeymoon period when students return to school. A lot of them are quite eager to see each other again and happy to be there, but it's after a week or so that some of those social issues might start to emerge. So my advice for parents is just to validate that, that is really worrying. That might be, I can see how that might be unsettling for you. Is there anything that I can do to assist with that? And then at the same time, supporting them just to ease back into their social interactions. They don't have to fill their social calendar straight away. It can be something done in a stepwise fashion.
And I think we're probably all feeling that a little bit as adults as well. People are starting to book things up and want to make plans, and there's a sense that there's a pressure to get back out there, but at the same time it sort of feels like it might be a little bit much or a bit overwhelming. And my understanding is there's quite a lot written about this kind of reemergence phenomenon, and we might have all been through it a couple of times now as we've come out of different lockdowns. So you've probably learnt what works for you and how to get back to things slowly. And your kids, your children, your teenagers, they will have learnt a little bit about what works for them too. So talking with them about taking things a bit more slowly and settling in as they feel ready, but perhaps they might need some help sometimes to actually a nudge to reconnect with some of their friends as well, and being there to do that for them. So that kind of brings me on to another really interesting thing that I think is important to talk about today. And I'm going to ask Michelle to chat a bit about this, wearing her adolescent specialist hat. A year and a half is not that long, depends how you look at it, but in our lives as adults, depending on what we're doing, it might pass by, and the things we were doing a couple of years ago maybe weren't that different to the things that we would be doing a couple of years later. We may not have changed that much either in that time, physically or otherwise, but for teenagers, a year and a half coming up to 2 years is actually really quite a long time, and often a big transition point for them, physically, emotionally and mentally. And so I'm going to ask Michelle to talk a bit about what that might feel like for teens, because I think that can help us as parents to understand what they're going through. And then I'll come to Lisa as well to tell us a bit about the research that we know when it comes to those transitions in teenage years. So Michelle, to you first.
Good topic, Anthea. Certainly, adolescence is actually the second greatest rate of growth after your infancy. Yeah. And so much change happens during that time, as Anthea has mentioned. So physically, they might have grown quite a bit taller. They might have developed facial hair. With lockdown, that might be accentuated as well. I think that there's changes in body shapes and sizes, and sometimes teenagers don't feel altogether so comfortable with that because it has been so rapid. And then there's also the fear of, being seen to have changed in that time as well. And from a mental perspective, I think that there's a whole lot of growing that grows in their brains, and a lot more thinking and introspection that can go on during this time. And during lockdown as well, with less interaction at school, there certainly is, more time to think about oneself and how one is and how one looks, which can then play out in different ways. And socially, things again might have changed because, friendships change, and therein, Chelsea and Anthea spoke about how it might be difficult in terms of navigating those changes and going back to school, and different levels of maturity. So there are different rates of change in different young people. So I think that also may put them out of step with friends.
Yeah, and so for young people who might be worried about that. So, for example, they may have entered lockdown or the pandemic 18 months ago, as really quite a prepubescent tween, and they may be coming out the other end as a more developed post-pubertal teenager. So, how do you talk to your young person about that? What are the helpful things that you can say, and what are the unhelpful things? Because I think sometimes as parents too, we don't realise that some of the things we say are really unhelpful, certainly me anyway. So Michelle?
I think some of the helpful things you can say is that everybody goes through these changes. Although everyone does it at different rates, and everyone has different shapes and sizes, depending on their genetic background and what their family background is like. So I think the helpful thing to say is that everyone's different, and what is most important is valuing what's on the inside rather than on the outside. Some of the unhelpful things of saying is, gee, you look terrible in that. So alluding to physical looks, that because teenagers are generally very, very sensitive about what they look like.
Yeah, fantastic. Thank you. And Lisa, coming to you now, welcome to the conversation. So tell us a bit about what we know is usual when it comes to this period of transition, and then that can help us to understand what's happening in the pandemic as well.
Yeah, thanks, Anthea, and great to be part of the conversation. Exactly as Michelle's saying, that this is a really, the adolescence is the second most transformative phase, where there's so much development happening for young people. And it is, as we've been hearing, it's a time where friendships are really, really important, and where teenagers are starting to spend more time with their friends, less time with family, and sort of working out really where they fit in the world. So in terms of the kind of big transitions that are typically happening during this time, like one of the big transitions for those kind of early children in their early teens would be that transition from primary to secondary school. And that's a really big transition in terms of working out kind of where you fit in terms of that transition through school, and kind of where you're where things that you're good at are in terms of sort of, is it academic, or is it more kind of with peers or sport, that sort of thing. And so these are the years where we're really kind of working that out. So obviously for lots and lots of children and adolescents, then those years have really been disrupted, and we're talking about 18 months, 2 years. So that transition into secondary school, they might not have had time to develop those friendships in the same way. And similarly, when we look towards the other end of school, I'm thinking about those transitions beyond and what adolescents might be doing beyond school. These are, again, really important years in terms of working out what's important for the young person and kind of where they see themselves in the world. So we know, for example, that big events that happen for young people during these years are much more likely to impact things like their political views and what they choose to do next in terms of staying in education, for example, rather than perhaps, especially with the sort of financial environment that we're in at the moment, then some of the jobs that might have looked like they were there post-school perhaps aren't, or that kind of security isn't there in the same way that it might have been. So that typically tends to shift young people to staying in education more as well. So we've been following a group of young people for the last 10 years, actually. So we have lots of information on these young people and what's happening for them before the pandemic, and then obviously now during the pandemic. And we found that for about 1 in 10, rising to about 15% of young people, they are saying that their plans for the future have changed directly as a result of what's happening with the pandemic at the moment. So it's definitely changing, it's definitely a disruptor, but I think that's what we need to be thinking about now as we move back into this recovery phase and thinking about, kind of COVID normal now and making sure that we're supporting young people in this phase.
Thanks, Lisa. And that's really, really interesting. And I guess one of the, if you like, there can be some really important silver linings or growth and resilience for people out of the pandemic. And I know, Linda, that you've talked a bit about resilience as a result of some of these experiences in young people. Perhaps you can tell us a little bit more for parents about how they might help to foster that for their child who might be going through some of these really big questions and starting to question the world and make them feel really uncertain or anxious.
Thank you, Anthea. One of the things that I frequently encounter is there is a sense of loss, as Chelsea was highlighting and Lisa was highlighting, that 18 months have gone by, major milestones in academic life, social life have not been fulfilled. So, and we don't want to negate the teenagers or the child's views about having a very different experience to what they had initially imagined or they may have seen in their relatives or their siblings. So the way we are navigating this space is to actually recognize, perhaps settle down and recognize that the teenage years are unique and extraordinary set of space for the mind, for the brain. Michelle highlighted the changes that happen physically, and there are extraordinary changes that happen in the brain or the software of our brain. So what really simplistically I can highlight is that the front part of the brain, which is around decision making and control and planning, analyzing, that kind of lags behind. That continues to grow till about mid-20s. But in teenage years, we use the back part of the brain, which is amygdala, where there is impulse, emotion, instinct that the teenager is guided by. So when that is the situation, there will be risk-taking. There will be new behavior pattern that the parent might see as the kid embarks onto the world post-pandemic. So the guidelines that we highlight would be coming back to a routine as quickly as possible. The routine will be slightly different to what they did for the past 18 months. And I'm referring to sleep, crucial. Michelle is big on sleep, so is Tom, so am I, so is Anthony. So sleep for our kids, number one. Then physical activity, whichever activity they're more engaged in, they enjoy, picking up new sports, going we used to do. Then the third would be gently getting back to the rhythm of academics. And that could be something in consultation with the school, return to a school plan if needed for in special needs situation. And overall, I really want to be appreciating the parents at this point, because without your involvement in the kids' lives, we are practically unable to deliver the care that we want to. So you're imparting the values, the structure, role modeling, that this is how we cope as adults, and we will help you as teenagers to go through this time. What will be some of the foundations on which the kid could move forward?
Fantastic. And so a good time now to pick up perhaps on that really, a few of those really specific routine and healthy habit concepts that will be important to try and build back into all our lives, but especially teenagers. So Linda's touched on sleep, and we know we have had some questions about sleep, and we've had one question from Robert, who said that his teenage son, he hasn't said how old he is, but his teenage son is up until all hours, often gaming, 2 or 3 a.m. He said, I'm long in bed before he goes to bed, so I don't even know how long he's up, but now it's difficult to get him up and awake in the morning and out the door. And this is a really common experience in adolescence, and it's not just limited to the pandemic, but it's certainly, we've found that it's become a much bigger and more common problem. So Michelle, what sort of tips would you have for Robert about how to deal with this?
Oh, thank you, Robert, for bringing this up. That is the question I get asked every clinic I have. So you're not alone. Everyone is out there struggling along with you in terms of trying to manage their young person's sleep habits. And certainly gaming has become a thing over the pandemic, more so because it is a way of connecting, young people connecting with their friends. And then they find it so rewarding and so much fun that they can't get off. I think getting back to school, however, as you say, does pose a little problem because they do have to get up earlier in the morning and get on that bus to get back to school. What I usually say to parents and young people is that try and set up a routine that I guess is replicated night after night, where you turn off the screens and have them out of the bedroom about an hour before they're meant to fall asleep. So if they're falling asleep at 2 a.m. or 3 a.m., what you might want to do is very gently wind back the sleep time. So it's very difficult. And I'm sure that, most of us adults would appreciate how, getting back to sleep, say after 2 or 3 a.m., all night work, work-related episodes, and trying to get it back to 10 p.m. So I think that for young people, it's easier to slowly wind it back. So you would wind it back by half an hour every 2 or 3 nights, and gradually move it back to their usual sleep time. And also, I guess, plan their screen time a little bit earlier so that they do have some time on their screens, but then also have a time where the screens go off. The other thing I think is limiting the amount of caffeine use. So lots of young people have started drinking coffee or tea or drinking energy drinks inadvertently to try and wake up for the school day. But however, we know that caffeine does have an impact on sleep. So that might be another thing to do.
Thanks, Michelle. Really easy to get into some of those habits at home too, because, children and teenagers have been able to access the pantry while they're remote learning, and they may have got into habits where they're eating and drinking things that they weren't having as much of before. So that might include caffeine, and remembering that chocolate as well is another source of caffeine. And I know I've visited the pantry plenty of times for some chocolate while I've been working from home. So I'm sure there's lots of teenagers out there that might have been doing that sort of thing too, and it can be affecting sleep. We heard just a little bit about screen time, and that's been a huge challenge through the pandemic. Obviously, there's been some really, really important benefits from screen use. Learning is an obvious one, remote learning, and for all of us, remote working. But there's also been a lot of social connection that's come from screen use, and we know how important that has been, and especially for teenagers, for all the reasons we just heard about, where that peer relationship is so important. Biologically, they need to be connecting to their friends as much as they still love their family. The friends become such an important part of their journey into independence. So, Lisa, I know you've done quite a bit of research around screen use, and I think it would be interesting just to highlight for parents where you might see concerns or red flags about screen use. It's not something that we can completely get rid of, or necessarily should. There's lots of benefits, but I know lots of parents worry that there might be things they should be looking out for, or that it might be affecting the mental health and well-being of their young person.
Yeah, thanks, Anthea. Well, as you say, and as we all know, screen use has really risen during the pandemic, and that's really for lots of good reasons. It's allowed us to keep working, and it's allowed, as you say, our teenagers to stay in contact with their friends, and that's been a really, really important part of this. In our study, I mentioned that we've been following the young people, so we've been able to kind of see how those rates have risen. And so before COVID, we found that about 1 in 4 girls were using 4 hours or more of social media a day, and that's risen to nearly 1 in 2 during the pandemic. So it's not a massive surprise, but it does show how much we've really increased our social media use. And we used to see that girls use social media much more than boys, but what we've seen as well as those gender differences have closed down a bit more. So boys have started to use social media more. And similarly, when thinking about video games, as Michelle mentioned earlier, we used to see boys use video games much more than girls, but similarly, the gender difference has closed a bit, and we've seen girls using video games much more as well. So about, in our study, about 20%, about 1 in 5 girls were using video games this year for more than 4 hours a day. So you can see by the time you've fitted all of this in, there's not a lot left for doing learning or going to sleep. So definitely, and we know, as you mentioned, we know that there's lots of benefits and that they've been particularly important during the pandemic. But we do also know from our previous research that having such high levels of screen use, and particularly using social media and things, is related to higher levels of mental health concerns and also can impact academic performance as well. So really, as we're making this transition into kind of a more normal world, then we need to just be thinking about what we can be doing to support our young people to reduce those levels. And I think the main message here is that not all screen time is bad. So really thinking about how your teenager is using not just social media, but all screens. So it's really important to be thinking about how they're engaging, and so a more kind of connecting and engaging with peers or with family members or creating content is going to be much better than just kind of passively viewing it just to kind of fill time and just because you're kind of bored and can't go anywhere. So one way of thinking about that is thinking about the 3 C's. So connect, create, and contribute. So thinking about if your young person is using their devices, just try and think about it. Are they using that in a way that's allowing them to connect with others? Perhaps they're creating content, videos, or being able to contribute to discussions, that are happening broadly. So I think, thinking about how we use social media and starting to think about, trying to reduce those, the amount that we're using it. So exactly as Michelle said, sort of taking it away from bedtime. And it can be a good time to be thinking about as a family how we're using media as well. So thinking about the kind of we sometimes talk about doing a kind of a family media plan, that sort of thing. So this can be a really good time to be thinking about that as we're getting into a different phase of life, and think about what, and involve your teenagers in this discussion, but thinking about what they think's reasonable, what you think's reasonable, and coming together around some decisions about how best to use media. And I think the other thing as well to be thinking about as parents is be a good role model. That's certainly something that I'm struggling with as well. We're used to being connected to our devices 24/7. So I think just trying to disconnect ourselves will be good for us, but also will be good for our teenagers as well.
Thanks, Lisa. Michelle, did you have something to add there?
Yeah, I was going to say that actually with community sport coming back, I think that will also help with sleep, and also with better sleep patterns and engaging with friends. So really encouraging your young person or your child to be participating in fun activities that involve others, I think is a good thing.
Absolutely. Thanks, Michelle. And we've done some research here at the Royal Children's Hospital in the National Child Health Poll, and we've found that physical activity and participating in organised sport has really reduced a lot over the pandemic, particularly in Victoria and New South Wales. So as things open up, it's understandable it might feel a bit daunting to get back into things, and we talked before about slowly emerging if that's what you feel is right for you and your child, but also really important to try and get back out there and reconnect with people, and doing physical activity in sport is a really great way to do that. And obviously, the more we do that, we fill our time with other things, it's easier also to reduce screen time. So one of the things when managing behaviour is it's really tricky if we tell someone, a child or an adult, to just stop doing something without providing an alternative activity or something to be doing instead. And there hasn't been a lot of alternatives through the pandemic that don't involve screen use. So now that we can get back out and be doing different things, hopefully we will see some of that time filled with things other than using screens. So I'd like to move on to another question now, and I'm going to pop this one through to Chelsea. And this is really about the school environment, and particularly a question about exams. So this is a question here from Amy, and she said, "Hi, I'm just wondering if the panel will be covering exam stress, please, for teenagers. Would be great to have some extra tips as they're back at school and doing exams already." Chelsea.
Great question, Amy. Yes, they are, and doing them in some unique conditions and circumstances. So I think the most helpful thing for young people doing exams is firstly to know exactly the context and the conditions that those exams are under. So I know for students who aren't in Year 12, there is still a mixture of online and face-to-face exams. So knowing exactly what their exam is going to look like is going to help. Tips for Year 12 students is to really practice as much as possible in those exam conditions. And for those in Victoria and New South Wales, that's going to mean wearing a mask. So this might sound silly, but making sure that you're practicing in the lead up to your exams whilst wearing a mask, and also pretending like it is the real deal, sitting up at a desk, not slouched in your bed, and, you know, setting a timer if your exam goes for 90 minutes and setting a timer for 90 minutes. So giving yourself the best chance to practice under those exam conditions is a really good way of easing anxiety. And then alongside that, things that the panel have already covered, making sure that our wellbeing and general health is in good shape as well. So making sure we're getting enough sleep before exams, and eating well and exercising too. So not forgetting those things as well.
Fantastic. Thanks, Chelsea. And I think that probably brings us on to a really important point to stop and talk a bit more about where there might be more significant mental health concerns or problems in some children. You could just, in the background, we are live in the hospital, so that's just an emergency announcement. I'll just let that pass. So getting back to what I was just talking about around mental health concerns in teens, so we have lots of things in place. We've heard lots of really great examples today about how things might improve and how we can better support our children and their mental health and well-being. But for some families, we know that there's really quite significant problems and they might be wondering whether they need to seek extra help. So particularly through the pandemic, we've seen anxiety has become a big problem, and another big issue has been that of eating disorders. So I'd like to go firstly to Linda just to talk a bit about anxiety more generally and what parents could look out for as signs that their child's concerns may be really significant enough that they should be seeking extra help from a professional. And then we'll talk with Michelle about eating disorders. So Linda, to you first.
Thank you, Anthea, and thank you for your extreme attentiveness despite the codes going on in the background. So with relation to anxiety and pandemic, what I have seen, and most of my colleagues, is kids with pre-existing anxiety are having worsening of their anxiety, panic, and we're also seeing kids who have been previously managing all right, first time presenting with anxiety and stress-related physical and mental psychological symptoms. So this is a serious issue, and if I can quote some data, there are some reports coming along from the GP land that the school refusal and anxiety have actually tripled in pandemic the last 18 months compared to years. So this is a significant issue for our teenagers. What I would encourage the parents of teenagers would be to actually be available to connect with your kids on a regular basis. And I know I've been a teenager myself, and so have all of us. And it's not easy to connect with a teenager because they're slamming off doors, I'm okay, eyebrows shrugging, they all go in. So my advice for that space would be not to give up. The moments when your kid is angry, frustrated, yelling, looking grumpy, sullen, are the moments love is critical. And the universal language of love is connection, communicating, and being present. Sometimes it's words, sometimes it's just you're being available. And you know your kids well to actually figure out what is the way to communicate best. So some of the things we know about anxiety is that there are two components that go in. So there is a thought element, which is, oh my God, I can't cope, the world's going to end, I'm not going to pass the exam, I can't make VCE. And then there is the physical body side of things, because mind and the body are totally connected. So there will be palpitations, sweaty palms, vomiting, nausea, diarrhea, headache, crying. So to notice any of these symptoms, and there are a range of symptoms that we can identify, and there will be resources on the post later on. If your child is experiencing any changes in the behavior, so the way they normally behave towards the family or to the siblings or peers, their academic functioning, their capacity to cope, study, engage in social activities, if you see any difference or things are not right, communicate and engage and see what's possible to explore. If the problems are actually worsening, the child is withdrawing, crying, losing weight, a lot of anxiety, a lot of panic attacks happening, there may be a time where professional help is needed. And that would mean connecting with your pediatrician, GPs, school counselors, school psychologists, or psychologists elsewhere. So I'll leave it there for kind of secondary level of contact, but I think it is critical to identify really early on that your child is experiencing a level of anxiety that needs professional help. 2 tips, I always like tips, 2 tips to offer. There is a technique which comes from mindfulness area, and I'm a mindfulness teacher. So one of the simple techniques we could practice ourselves, I do that myself, and we could teach, is stop. S-T-O-P. If there is anxiety bubbling along and we're noticing it, we stop what we are doing. T, take a breath. Sometimes I say take 5 breaths. O, observe. That is to ground, so observe 5 colors, the touch, the fabric, the smell, the taste in the mouth. P is proceed. So stop what you're doing, take a breath, few breaths, observe what's happening to ground. P is to proceed. Very simple and doable, and you could try it out with your kids. especially I think Vicky was asking for a 13-year-old child anxiety about returning to school. So perhaps you could try that out the night before in the morning as well. And practice. The other would be the grounding. So there are ways of grounding we teach the kids. And for example, 5 things that you see in your environment, or 5 colors that you see, or 5 things you like, what you're wearing, what colors someone else is wearing. So these are the ways to actually ground them to the reality of what they're seeing, what they're hearing, what they're experiencing. These are simple, very effective tools, and with practice, the kids can get really better and efficient in it.
Fantastic. Thank you so much, Linda, for those really practical tips. Stop and grounding. I'm filing them away myself as well. And really helpful for parents listening out there to use for yourselves as well. And we will talk about parent mental health in a minute. Now, I know Chelsea would have lots to add from a school counsellor point of view too, but I'm mindful of our time and I do want to get on to talking just a little bit about eating disorders as well. So thank you, Linda, for that summary around anxiety. And we'll perhaps pop a few extra things up in the thread because I know we could talk a lot more about that topic. But let's just come to Michelle, because we do know that eating disorders have increased significantly over the pandemic. And Michelle, there might be some parents out there, we've certainly had some comments where they're worried that they're not really sure whether the habits and behaviours of their young person have been just super healthy or maybe actually they represent an eating disorder. So in just a few minutes, I know we could spend a long time talking about this, but in just a few minutes, what might be the signs, the red flags for parents to look out for if they're worried about their child possibly developing some unhealthy patterns around eating? And where would you suggest they go as a first step for help?
Sure. Thanks, Cynthia. Yes, eating disorders have really doubled over the pandemic. Lots of GPs, pediatricians, and also adult specialists have recorded increases during the pandemic. And part of this, I think, and we've got some data that has come from an audit that we've done on our patients, is that there's increased time that's spent thinking about oneself. And I mentioned earlier changes in body shapes and sizes. The loss of community sport and has also contributed because teenagers have taken it into their own hands in terms of trying to exercise on their own and controlling how much they eat, and also worrying about, putting on the COVID kilos, which has been talked about so much in the media during the pandemic as well. So teenagers have decided, right, I'm going to try and eat more healthily, go on a diet, actually come out looking better than what I was prior to this. And sometimes it's simply becoming more healthy, but for a certain proportion of vulnerable young people, and that has tipped them over. And that might be because there is a genetic predisposition for them to to develop an eating disorder. Sometimes it develops on the backs of anxiety disorders and depressive disorders as well. So the signs really that to look out for are increasing restriction, just getting much more restrictive about the types of foods they're eating and becoming incredibly obsessive about it, counting calories, also feeling extremely guilty after eating, and not wanting to eat with people. So not wanting to come to the dinner table. Also, the dinner table becomes a huge fight between parents who are concerned and the young person. And there's this huge amount of resistance to trying to increase their intake. Other behaviors are cutting up foods into little bits, chewing for long periods of time, and also much more concerningly is, purging after meals as well.
Thank you, Michelle. I'm just going to jump in there because we've just got a few minutes to go. And I know for people listening who might want to hear more about that I can direct you to our podcast, which we'll pop the link to in the feed, where Michelle has talked quite a lot about those signs and where to go for help. And certainly reaching out to the school counsellor or your GP would be good options if you're worried that this might be a concerning habit or problem that's happening with your young person at home. So we've just got a couple of minutes left, and I think I want to take a moment here to thank all of you, obviously, for watching and joining in today, and also for all the amazing work that parents have been doing out there with their children and teenagers over the last 18 months to 2 years, whilst trying to stay well ourselves. We haven't talked today about parent mental health in much detail, but really important to acknowledge as well that our own mental health as parents is a really critical part of how we look after our children and young people. If you're having difficulties at home and this has raised some concerns for you and you would like to reach out for help, then we'll pop some numbers up now on the screen for Beyond Blue and Kids Helpline and Head to Help, which are all great places where you can access support, and there's some more information in the feed as well. A big thank you to our panellists as well for joining us today and all their incredible insights and wisdom. And of course, a big thank you to everyone here at RCH for being part of this process, and to the Department of Health who've supported us in putting this important webinar together for you today. We have got a short feedback survey, so if you could take a minute to feed back your thoughts and tell us what you thought, that will really help us when we're developing new webinars and other things to help give parents information going forward. So that's all from us today here at the RCH. Thank you once again for joining us. We will be back with some more information on preschoolers and younger children in a couple of weeks' time, so stay tuned on the Facebook page for more information about that. Take care and look after each other.